Hi, this is Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University. And a question I get asked quite a bit about COVID-19 is, okay, now it's August. What should we be doing? It's an important question because Tennessee just passed a couple of very major milestones. We just passed 100,000 documented cases and over 1,000 deaths. So this is a serious disease for us in Tennessee. So what should we be doing? Well, it isn't black and white. As I've said before, if it was simply a matter of health, we would all just stay home. If it was simply a matter of the economy, we'd all just open up. But it isn't. It's a balancing act. We need to be vigilant and careful. My advice to people is if you don't have to have meetings, don't. If you don't have to be near somebody, you won't get exposed. If you're not exposed, you won't get sick. But if you do have to have meetings, wear an appropriate face covering. It just makes sense, right? It'll block things from coming out from you, and it'll block other diseases coming into you. Maintain social distance, of course, but remember, social distance has two aspects, both distance and time. I'd rather be 3 feet from someone for 10 seconds than 6 feet for an hour. Okay, distance and time, both. Practice good hygiene, good hand washing, covering your coughs, etc. Keep surfaces clean. There's a lot of controversy about whether the virus spreads from surfaces, but we know other respiratory viruses do, so it makes sense to keep surfaces clean. Please don't penalize those who stay home because of illness or risk of exposure. We've got to encourage people who are ill not to come to work, and folks who are at high risk shouldn't come anyway because they may get exposed and they may get sick. We have to support our health department's efforts to test, to contact trace, to quarantine, and to isolate. We've got to allow, if the health department contacts you and asks you to quarantine, please do it. If they ask you for your contacts, give them. If they ask you to be tested, please do that. These are critical efforts to control the pandemic. Obviously, if you need health care, no matter what, seek it, whether it's for the COVID-19 or any other disease. And we have to work together to assiduously protect those at high risk, the elderly, those with chronic diseases, and others. And finally, we have to be ready to pivot as the data indicate. This is still an evolving pandemic. The numbers are still going up in our state and our region. We need to continue to do the things that we know make a difference. There's a great deal more information about COVID-19 on the College of Public Health website. If you go to this icon, it'll lead you to a lot of other videos. If you have specific questions, please don't hesitate to contact me. I'd be happy to try to answer them or find an answer for you. Thank you very much.